ever wondered about the mysterious disease X that's been making headlines recently? Let's delve into this enigma, shall we? Disease X is not your typical disease. It's not like the flu or measles, where we know the cause and have established treatments. Instead, disease X is a hypothetical disease, a placeholder, if you will, for an unknown pathogen that could potentially trigger a devastating epidemic in the future. This concept might seem a little daunting, and rightly so. It's a stark reminder of the unknowns we face in the realm of disease and our ongoing vulnerability to new pathogens. But why do we even have this placeholder? It's because we understand that our world is constantly evolving, and with that, new diseases can emerge. The existence of disease X is a recognition of this reality. It represents the knowledge that a serious international epidemic could be caused by a pathogen currently unknown to cause human disease. So, disease X is not a specific disease, but a representation of a potential unknown threat. Now, you may be asking, why should we care about a disease that doesn't even exist yet? A fair question, but let's dive deeper into the enigma that is disease X. Disease X is not so much a specific illness, but rather a placeholder. It's a term coined by the World Health Organization to represent a hypothetical unknown pathogen that could potentially cause a future global epidemic. It's like a shadow lurking in the corners of the medical world, an unwelcome reminder of the potential for new and unexpected health threats. Why is this important? Well, history has shown us that new diseases can emerge and spread rapidly. Think of the Spanish flu in the early 20th century, or more recently, the onset of the HIV/AIDS pandemic, SARS, and the global spread of COVID-19. All of these were once unknown diseases that suddenly burst onto the scene, causing widespread devastation. Preparation is key in the world of global health. We cannot predict with certainty what the next big disease outbreak will be or when it will occur. But we can be sure that there will be one. That's why the concept of disease X is so vital. It's a part of a blueprint for research and response strategies, a call to arms for scientists and health professionals around the world to be ready for the unpredictable. Being prepared means investing in research, surveillance, and infrastructure. It means having systems in place to detect outbreaks quickly and respond effectively. It means developing flexible vaccines and treatments that can be adapted as needed. It means understanding how diseases spread and how to prevent them. The idea of disease X is not intended to scare us, but to remind us of the importance of vigilance and preparedness. It's a call to action, a challenge to the global community to step up and be ready to tackle whatever health threats may come our way. So, in a world where health threats are ever evolving, disease X stands as a symbol of the unknown, of the diseases that are still to come. It's essential to be prepared, as disease X represents a future international epidemic caused by an unknown pathogen. But how much of a threat could disease X actually pose? This is a question that has been on the minds of many health experts worldwide. You see, the potential severity of disease X is no light matter. Disease X, like any other unknown disease, carries the potential to spread rapidly and extensively, crossing borders and continents with ease. The global village we live in today, with its high-speed travel and interconnected economies, acts as a fertile ground for the spread of such diseases. The ease of transmission could result in an outbreak that is not just local or national, but potentially global in scale. But it's not just about how fast or far disease X could spread. The real threat lies in its potential to cause severe illness or even death. And this is where things get a bit tricky. As disease X is unknown, we have no way of predicting its severity, and hence no way of preparing for it. This makes it much more dangerous than diseases we know and understand. To give you a sense of the potential devastation, let's take a stroll down memory lane and look at some previously unknown diseases that have wreaked havoc in the past. The human immunodeficiency virus, or HIV, emerged in the early 1980s and has since claimed the lives of over 30 million people globally. Similarly, the severe acute respiratory syndrome, better known as SARS, emerged in 2002, and within just a few months, it had spread to over 25 countries, causing widespread panic and economic disruption. These examples serve as stark reminders of the potential impact of Disease X. We don't know what it is, we don't know where it will come from, and we don't know when it will strike. But what we do know is that it has the potential to be a serious global health threat, just like those we've seen in the past. So, the threat of Disease X is not something we can afford to take lightly. It's a ticking time bomb, a silent menace lurking in the shadows. As we've seen in the past, unknown diseases can cause serious global health threats. And Disease X could very well be the next one. How can we protect ourselves against an unknown disease? Now that's a question that has puzzled humanity for centuries. Despite not knowing what Disease X might be, we can still arm ourselves with a strong defense. So let's explore how we can do that. Firstly, the backbone of any defense against unknown diseases is a robust public health system. This system should be capable of providing quality healthcare to all, irrespective of their socio-economic status. It's not just about having hospitals or clinics, but about ensuring that these facilities are well equipped and staffed to handle any health crisis. Let's not forget the importance of surveillance in detecting new diseases. It's like having a watchtower that keeps an eye on the health landscape. With effective surveillance, we can quickly identify any unusual patterns of illness or spikes in disease cases. This early detection is crucial as it allows us to respond promptly and contain the spread of the disease before it becomes widespread. Of course, our defense wouldn't be complete without research. The world of microbes is vast and ever-changing. We need to constantly study and understand their behavior to stay one step ahead. Research helps us develop diagnostic tests, treatments, and vaccines for new diseases. It's like having a crystal ball that gives us insights into the future, allowing us to prepare for what's to come. But it's not just about having these measures in place. They need to be integrated and coordinated for a successful defense. Think of it like a well-oiled machine, where each part works in harmony with the others. A public health system that provides quality care, a surveillance system that detects new diseases quickly, and research that equips us with the necessary tools to fight these diseases, all working together. So, while Disease X may be unknown, we are not helpless. With a strong public health system, effective surveillance, and continuous research, we can prepare ourselves for whatever comes our way. Remember, preparation is the best defense against the unknown. So, what does the future hold for Disease X? Well, as we venture further into the 21st century, the landscape of health and disease continues to evolve. With Disease X, the unknown pathogen that could potentially cause a future epidemic, the stakes have never been higher. The future is not a matter of chance, but a matter of choice. And the global health community is choosing to be prepared. Scientists and researchers worldwide are tirelessly working towards understanding this enigma better. They are exploring the unknown, making strides in the dark, all in the quest to illuminate the path that leads to Disease X. One of the most promising developments in this endeavor is the creation of flexible vaccine and treatment platforms. These platforms are not designed for a specific disease, but rather for a range of pathogens that share common characteristics. This means that when Disease X does reveal itself, we have a head start. We're not starting from scratch. We have a foundation to build upon, a starting point to launch our counterattack. But it's not just about medical breakthroughs. The fight against Disease X is also about maintaining a robust public health infrastructure. We need to ensure that our health systems are equipped to detect, monitor, and respond to health threats promptly and efficiently. This means investing in healthcare personnel, in disease surveillance, in laboratory facilities, and in emergency response capacities. The importance of continued vigilance cannot be overstated. Disease X may be unknown, but it is not unforeseen. We know it's out there. We know it's coming. But we also know that we have the tools, the knowledge, and the determination to face it head on. So, as we look to the future, let's not be daunted by what we don't know. Instead, let's be inspired by what we can achieve when we come together in the name of health and humanity. The future of Disease X depends on our preparedness. Stay informed, stay vigilant, and remember, health is wealth. In conclusion, Disease X, while unknown, is a serious potential threat. We've journeyed through its enigma, understanding that it represents an unpredictable future epidemic. It's cloaked in mystery, but what we do know is that it could pose a grave risk to global health. The threat of Disease X is real and imminent. The uncertainty surrounding it should not lead to complacency, but rather it should spur us into action. It's essential that we are prepared. Our defenses must be robust and our response swift. Looking towards the future, it's clear that Disease X will continue to be a subject of extensive research and discussion. Its impact could be significant, but armed with knowledge and awareness, we can mitigate its potential effects. Thank you for joining us today. Stay safe, stay informed, and remember, knowledge is power when it comes to health.